Welcome. My name is Peter Strong. I'm a professional online therapist and I specialize in mindfulness therapy for the treatment of anxiety disorders, including agoraphobia. So if you're interested in seeing an online therapist for help with your agoraphobia, then please do contact me. Go to my website, learn more about the online mindfulness therapy service that I provide, and then reach out to me by email. Feel free to ask any questions you may have about online therapy and the mindfulness approach that I use. Mindfulness therapy is very effective indeed, and in this treatment plan that we'll work out together, you will basically learn how to apply mindfulness to progressively overcome your fear of leaving your home. So the way we go about this is called mindfulness-based exposure therapy, and this is a process where you schedule a series of exposure challenges of increasing difficulty, as in other forms of exposure therapy. But before you do any challenge, you do a great deal of training using mindfulness-based methods. And I will teach you how to do this. But the idea here is that you apply mindfulness beforehand and meditate on the challenge that you're about to do. You play through the challenge in your mind. You watch for any triggers and the anxiety that results. When you find that anxiety, you then work using mindfulness to completely change your relationship to that anxiety, to prevent it from overwhelming you and to prevent it from proliferating, but also to help it heal and resolve itself so that you can imagine doing the challenge with no anxiety at all before you go on to do the exposure challenge. So that's the secret. Exposure therapy by itself is not sufficient. You must do some kind of training to neutralize the anxiety before you actually do the live challenge. And that's what makes the difference. So when you take this very strategic approach, you will see changes quite quickly. I have worked with people who have suffered from agoraphobia for sometimes many years, and they have been able to progressively expand their area of activity in the matter of a few weeks, and usually within a month they are able to go to the supermarket, the mall, and other places that would have been impossible before. So anxiety is simply a habit. It's a conditioned reactive habit. And we need to change these habits. And the first way you change any habit is by bringing more mindfulness to it, more consciousness to that habit. Habits operate automatically, unconsciously. So you must make those habits conscious first of all. And we do that through this process of mindfulness meditation on the emotions and the triggers that form those habits. So there are various techniques that we will apply during the mindfulness training. Meditation is the primary way. All that meditation means is that you focus conscious awareness on the particular aspect of mind that you're focusing on. In this case, it's the anxiety. We work on changing our relationship to that anxiety so that instead of just becoming overwhelmed by it, we change the relationship to becoming the observer. And this is a critical shift. When you can observe your fear without reacting, then you are well on the way to changing that anxiety habit. So that's the first part of the training, learning to sit with your anxiety without reacting, without identifying with that anxiety, without becoming consumed by it. The second part of our training is to help the anxiety heal. And there's various ways that we go about doing this, but the primary focus really is on developing a compassionate relationship with that fear. So the reactive habit is usually based on hatred, on fear itself. Fear of the fear is the real problem here. When you can change that relationship to one of compassion towards that fear that you're now observing instead of reacting to, then you can begin to help it heal. You think of the fear as being like a child. The child is not very capable of solving its own suffering. If it's afraid, it can't heal that fear very effectively by itself. It needs to make contact with the child's father or mother in order to make a connection between the fear in the child and the fearlessness in the parent. So when that bond is strong, then the child is able to overcome his or her fear by absorbing the fearlessness of the child's parent. It's the same process that we will be applying to work with our internal fear. We build a compassionate relationship with that fear, and in a sense we become the parent to that fear. And when that fear feels the connection to that part of you that is not reacting, that is your observer self, your true self, then that is what allows the fear to heal. So the fear learns how to heal itself through this internal relationship that you build through meditation on the fear. This may be quite novel for you. It's a different way than is typically taught by other therapists, but it is very effective, and I have helped many people over the years now using this mindfulness-based exposure therapy. If you would like to learn more, please contact me. If you have any questions, please contact me. If you would like to get started on a treatment plan using mindfulness-based exposure therapy, then contact me and let's schedule a therapy session via Skype. I do all my online sessions using Skype, and it works extremely well. So please reach out to me and let's get started. And so you can see just how effective it can be to use mindfulness for overcoming the anxiety and fear. Please contact me. Thank you.